It's Joseph, and we got our model call patient here. Question number 1. How do we decide whether filler is best or PDO thread is the best for the nose contour? Number 1, I look at the width of the tissue here. For patients who have previous fillers, if the tissue in the nose bridge is widening, then it's probably not a good idea to put a lot more fillers here because they'll just cause it to be wider. The threads are sturdy, and when you put the threads in, you can stack them up one after another, and it usually just props it forward. And the projection, resulting in more narrowing of the nasal bridge and elevation of the nasal tip. Threads is better for this case to avoid further widening of the nose bridge. The second thing about putting threads in the nose is making sure that a patient has enough tissue here. If there's not enough soft tissue, things like skin, subcutaneous, muscle, put the threads in, they will see the outline of the threads. Eyes, her nose tip. And I just want to show everyone the threads I'm going to be putting in like this. 18 gauge. I'm going to enter through this area that I just did an entry there. Alright, so I'm going to go ahead and insert the cannula. This cannula allows me to deliver a little bit more light for injectors. The intersection between cartilage right here in the front and bone, there is a tight spot that we need to squeeze through. We're going to meet resistance right here. So we just have to keep tugging at it. As it passes through, it's going to be a lot easier. I always ask the patient that if they had surgery before on the nose, surgery, it just makes it a little bit more complicated because the vessels, the blood vessels are different. Here's the thread. We go ahead and insert the first one. You lift the tissue of the nose toward the threads from muscular layer. I'm going to try to pass through this tight junction again. The first one usually takes time. The following one should be a lot faster. I'm trying to attach the bone and come up all the way. When I insert the second one, you shouldn't feel too much discomfort. I'm trying to go through the tight junction level.
0.
See in the video that the nostril is smaller. It's more narrow because the nose is a lot more projected outward. Asian will tend to be flat here. She has a more Western profile because her forehead, her nose, her chin is more projected out. How is that pain level?
I would say 1, but it's not pain, it's more of a pressure as you are massaging the nose.
Do you see the results?
Results are pretty obvious. It's honestly like magic. I could see a huge difference for sure.
Do you notice your nostril?
Yup.
Thank you.